sometimes the drugstore just doesn't do the trick. Instead, you've got to head to the doctor's office for some prescription beauty.
You can go and use over-the-counter products, and I recommend a lot of my patients to do that for maintenance care, to exfoliate, to keep your face moisturized. There are great over-the-counter products for those purposes. But when we get to a stage where we've got significant photo damage, sometimes we need to pull out the big guns and use prescription products.
For those with adult acne, putting your best face forward can be challenging. However, facial plastic surgeon Etai Funk says that the topical prescription Obagi Cleansoderm is a great solution.
It's a 5% benzoyl peroxide, and the beauty in this product is that it's solubilized. So this benzoyl peroxide, it's not the type that you get over the counter. It'll actually penetrate a lot deeper into the skin and get to the root of the cause of the acne. With any of these products, you need to be using the product for at least about 6 weeks until you really start to see good results. But you need to be on the product long term for at least about 3 months to see the full effective results of these products.
Another condition that may need a doctor's attention?
Rosacea is an inflammatory condition, which we were not quite sure what the cause is. It's that redness, that inflammation that we get here along the cheeks, along the nose, and up here in the forehead region.
Almost 80% of people who have rosacea don't even know it, and they don't realize that there are plenty of treatments out there to help their condition.
Metrogel 1% is a product. It's a gel that we apply nightly in these areas. And again, it'll take about 6 weeks until we start to see results, but we see phenomenal results with the Metrogel. The other product that we have is Finacea Gel, but the beauty in this product also is that it'll help with pigmentary issues at the same time that it treats the rosacea. We have a lot of patients who have a lot of sun exposure, especially in warmer climates, and those patients will develop sunspots, freckling, and photo damage to their skin. Well, we have a great product for the dyspigmentation, for those pigmentary changes that you'll have on your skin, the sunspots, which is called hydroquinone, 4%.
Jennifer applies hydroquinone nightly. Dr. Funk also prescribed something for fine lines and wrinkles around her eyes.
Well, all the products we've talked about this far, Rebecca, work from the outside in. Well, this is a fantastic product because it works from the inside out. It's the only product that's been proven to stimulate collagen.
There's a great product now called Renova.
Renova has a much lower concentration of this tretinoin, of this retinoid. It's 0.02% versus 0.05% or 0.1% that we've seen for the Retin-A. And it's based in an emollient, in a moisturizer that really prevents you from getting that redness.
I've been using Renova for a couple of weeks and have really noticed a clear complexion and a more uniform look to my skin.
Another skin condition that needs medical attention is melasma.
We really see it in a lot of women who are pregnant or are having hormonal changes or have just started an oral contraceptive. And we call it the pregnancy mask, and we'll frequently see that through there. Well, we have a great prescription product for that as well. It's called Triluma, and this one combines the retinoid product, 0.05%, with the hydroquinone and a steroid. Well, why a steroid? To help prevent that skin irritation, that redness from that retinoid product.
However, Dr. Funk warns,
we want to take every precaution when a patient's pregnant. Therefore, I recommend they start using it after pregnancy.
And from clearing your skin to improving your lashes, Myra Golden came to Dr. Funk to help her grow her lashes, which were virtually invisible.
Maybe 7 or 8 years ago, I started noticing that my eyelashes were not as thick or as dark, and it seemed that I needed to wear mascara more than I used to.
The solution?
Latisse really gives you those long, luscious lashes you've always wanted. You apply it nightly, you'll see results at 8 weeks and full results at 16 weeks. Studies have shown that it'll lengthen the lashes by 25%, it'll make the lashes over 100% thicker, and it'll make their lashes 20% darker as well.
Women may want to grow luscious long lashes, but men also need some special attention. These skin products are beneficial to a man's appearance, but for men experiencing baldness, the pill Propecia gets to the root of the problem. When taken regularly,
in about 48% of patients, they saw regrowth of hair, and over 40% of patients, it prevented any future hair loss. However, we do always need to discuss some of the side effects. In less than 2% of patients, these side effects occurred, which were a bit of a decreased libido and an elevated PSA, which is a marker for your prostate. This product is not recommended for women, specifically pregnant women, because it can alter fetal development.
And Dr. Funk's last bit of advice?
This is your face you're dealing with. It's your social fingerprint to the world. You want to take care of it, and you want it looking its best. So don't try and self-prescribe. Go see a trained physician who understands these products and can assess your skin and really knows which product will best treat your skin.
In the past, removal of skin cancer or precancers often result in scarring. However, a new chemotherapy cream is offering breakthrough treatment options.
Each one of these red lesions here would eventually turn into cancer.
Lou Jackson is constantly finding skin cancers and precancers on his face, even 3 melanomas.
They would freeze them, cut them off, burn them, whatever. But every 90 days, I was guaranteed something was going to pop up somewhere.
Finally, he tried a cream that's kind of like chemotherapy in a tube. As you can see in this photo, it brought out precancers all over his face and then healed them.
After 4 days, we stopped the treatment. 10 days later, I was back with no...
And it removes precancers with no scar and no knife. This is Aldera, a new cancer-killing cream. It removes basal cell skin cancer by boosting your immune system to kill the cancer cells. It takes 6 weeks, and though there are no scars and no knives, it's not an easy treatment. But if you have skin cancer or precancers, now you have some options.
If it's just 1 or 2 precancerous lesions, I think freezing is probably a better way to go because it's quicker and you get it over and done with. If you're treating multiple ones, though, I really think the creams are better.
The creams treat a wider area, but you look bad while it's healing. If the skin cancer is a bump, Orengo says it should be cut out.
If you actually have a bump, a lump, then you want surgery. You don't want the creams.
And melanoma must be cut out. But for Jackson's precancers, chemo in a tube worked.
I think it's great. I just like for other people to give it a try.
For more information, check our website, livewellhd.com.